I'm Brittany Lewis with Forbes Breaking News. On Wednesday, Florida Governor Ron DeSantis blamed open border policies for the continued surge of fentanyl deaths in his state and across the country. DeSantis spoke at an event touting a Florida drug rehabilitation program called the Core Network. DeSantis blamed President Biden for failing to secure the southern border, through which deadly drugs pass on a daily basis. The southern border and continued illegal migration have become a political liability for Biden and the Democrats heading into the midterms. Republicans have sought to convey a message that every town is a border town due to the ongoing flow of undocumented people. DeSantis has positioned himself as a tough on illegal immigration voice in the Republican Party, continually sparring with the federal government over migrant resettlement policies and routinely threatening to send border crossers who have reached his state to Delaware and Washington, D.C.
So part of the reason that we're here is because we have an open border, a border that was deliberately opened in January of 2021. We've seen millions and millions of people pour into the country illegally from all over the world. I was down there last summer. You had people from Libya, from other parts of Africa, Asia, Middle East. It was not mostly Mexicans coming. It was people from all over because the word went out, just show up at the border. There'll be people from like Haiti. You know, Florida's a lot closer to just come to Florida, but they'll go all the way into Central America from Haiti, and then they'll go all the way up knowing that they can get in. And so that's what the message has been sent, basically, that just go to do it. Now, having a flood of people is a huge problem. It's interesting. They're fine doing it when it's affecting people they don't like, in red states, for example. But when you bring that to their doorstep in Washington, D.C., or New York City, they don't like that very much. And so that's a huge issue, just the sheer volume of people coming illegally, what that does for social services, education, health. Of course, it does lead to more criminal activity. Some of these are criminal aliens when they come in. Some people have already been deported and they're coming back in. So you have all those issues. But what you also have is this has been a huge increase in sex trafficking and human trafficking, particularly against very young, vulnerable people. And it's been an absolute boon for the Mexican drug cartels because they are moving so much product across the southern border like they've never been able to do before. So you look at something like fentanyl, China is making it, and then they're bringing it through Mexico, through the southern border into the United States. And, you know, China, why doesn't the United States hold them accountable for a change? They did all this with COVID. They lied about COVID. They're doing all this stuff with fentanyl. They're a major, major problem, but yet we know that they want to get fentanyl into the United States. We know the easiest way for them to do that is to just bring it through the southern border. And what is happening? They're letting it come in effectively with these disastrous policies. And so now in the United States, and this was not true even 5 years ago, the leading cause of death for Americans 18 to 45 is overdose from fentanyl. If you look at what's happened here in the state of Florida, already we're a little more than halfway through the year. There's already been almost 2,000 reported fatal overdoses just in the state of Florida. And we're seeing this in state after state. This is affecting communities across the country. When we would send people, I sent people to help Texas on the border. We've done other things to do. People say, oh, you're not a border, the media. Oh, you're not a border state. What do you care about it? Well, yeah, everybody is affected by this. It's not just limited to the Rio Grande communities or communities in Arizona. This is affecting everybody, and it's affecting people in a lot of different ways. But this fentanyl has got to be the number one thing that's happened. If you look at the spike in the fatal fentanyl overdoses just over the last couple years, I mean, it is way, way more than virtually any other drug that you can point to. And what they're doing, too, with the fentanyl, they will lace it into things that people perceive to be less dangerous. And so then they end up doing it, and they have these major, major episodes. A little bit of fentanyl, I mean, how much fentanyl would we need to kill everyone here? Just enough to hold in your hand, probably. It is it is very, very devastating. And the amount of fentanyl that comes in across the border has been enough to kill hundreds of millions of people over the last 2 years. I mean, it's incredible the amount that's come in. So this is really, really dangerous. And narcotics have been a problem for a long time. It ruins people's lives. It ruins family, all that stuff. That's why one of the things that I'm proud of is our First Lady and her initiatives, what she's doing. She has a program called The Facts Your Future, and what she does is she communicates the dangerous and life-altering effects of abusing drugs to our kids and to our teenagers throughout the state of Florida. And the goal is to protect their physical and mental health from the ravages of illegal drugs as they're growing up. And I don't think it's ever good to do fentanyl or some of these other things, but these young kids really has a devastating impact. This program allows them to see the dangers firsthand of substance abuse and encourages people to maintain a healthy lifestyle. She has, because she's worked with the State Board of Education in Florida, established a 5-credit-hour requirement on substance abuse and mental health for Florida schools, which I think is something that'll make a big difference. And so she has really led and provided a blueprint to help protect our young people. But this is something that has massive, massive impacts on families, on individuals, on communities, on states, and on our country. So we need to do everything we can to fight back against it. And that, yes, that involves doing things like being strong on illegal immigration. I mean, obviously, I in Florida don't control that. I wish we had better leadership that would take it more seriously, but that's just the reality. But there's other things, that we can do. We just signed legislation where we increase the penalties for people that are dealing in these fentanyl analogs. They are going to go, when you are putting fentanyl out on the street in the state of Florida, you are killing people by doing that. And we're going to treat you with the severity that deserves. And you're going to jail, and you're going to jail for a long time. So we want to stop it from coming on our streets, hold the dealers accountable, hopefully convince people not even to try anything of that nature. But we also understand that an important part of this is we have to work to try to break the cycle of addiction. We want Florida families to be able to break free from what's really, really a harmful cycle. And so today, we are announcing a massive expansion of a first-of-its-kind model of care for substance use disorder, coordinated opioid recovery, a network of addiction care, and we're calling it the CORE Network. And it's a coordinated effort between the Department of Health, Department of Children and Families. This is an approach that was pioneered in Florida. You will hear from a couple of the speakers about what was done in Palm Beach County. But what we are going to be doing is taking that model that's had success there. We're taking it to 12 additional counties. These are counties that have a demonstrated need for the services, that they have existing programs that can serve as a foundation. They have strong interest from community partners, and they are actively interested in supporting the network. So we're going to implement the network right here in Brevard County, as well as Clay, Duval, Escambia. Yeah, it's important. Gulf County, Manatee, Marion, Pasco, and Volusia. That'll be very, very soon where those counties will come online. We've also identified Citrus, Flagler, and Pinellas to expand the network to at a later date. And this network will be able to streamline resources and break down barriers for those battling addiction. The three-prong approach to recovery includes, yes, the important rescue response that our EMTs do and those field people that are in medical stabilization and assessment of the individual patient, and long-term treatment so that they can live productive lives without constantly relapsing and staying on this hamster wheel of addiction. So we don't want Floridians to receive overdose treatment and then simply be sent back into the world for this to happen all over again. So we're trying to give them the tools they need to navigate their path to a productive drug-free future. So this network, yep. Now, this network will be overseen by Florida's first statewide director of opioid recovery, Dr. Courtney Phillips, who I mentioned earlier from Palm Beach. She has experience working with teams of mental health counselors in primary care settings and in medication-assisted treatment clinics. She's going to bring cohesive leadership to what should be and can be a life-saving statewide program. And so we mentioned fentanyl overdoses in our state. We're seeing more than we ever have. Fentanyl overdoses account for almost 70% of all overdoses in the state of Florida. And since 2015, fentanyl-related overdose deaths have increased by almost 800%. And so you have Brevard here with the Sheriff's Office. They continue to face the high threat of drug trafficking and abuse in our communities here on the Space Coast. This year, Brevard County Sheriff's Office with the Central Florida High Intensity Drug Trafficking Area Team has seized 10 kilograms of fentanyl. 10 kilograms of fentanyl is enough to kill 5 million Floridians. So this is the same amount of fentanyl seized in this region during all of 2019. So don't let anybody tell you that that open border is not affecting our communities here in the state of Florida. It is having a devastating impact. 72% of all drug-related deaths in this particular area involve that people don't perceive as risky as fentanyl, but they don't realize that there may be fentanyl in those drugs anyways. And so it's a really, really hazardous thing. And they've also seized here in Brevard 8 kilograms of heroin this year, which is a huge, huge problem. So we're working with law enforcement, we're working with our first responders, we're working with people in the medical facility and the medical community to make sure that we break this cycle of addiction. We'll throw the people in jail who are dealing with this, and I know Wayne Ivey takes it very seriously. Most places in Florida do. But, you know, some of these people that end up in addiction, some of them maybe they made like one or two bad choices, but they're not bad people. You know, they get caught up and it becomes very difficult. And so that's where we come in with this program to be able to get them on a sustainable path forward. And that's going to make a huge, huge difference, because when you have folks that are going down this, the relapse once, twice, you know, eventually they're going to get into a situation where they're going to have a life-threatening overdose situation. I mean, that is typically what ends up happening when you get into these deep funks. So I'm glad that we're addressing this. I want to thank the folks who are here, who you're going to be hearing from. You know, we've been talking about doing this and really working through what the program would look like now for a couple of months, just to make sure that we had all the I's dotted and the T's crossed. And I think we've been able to get that done here today. And I'm really excited about what this can do to help people throughout the state of Florida. So